Good evening, guys. I've got discussion for you. We're discussing mobile clinics and senior care. So we'll get into that shortly as soon as I set up for the show. Give me a few minutes, please. Give me 1 second, guys. I have to get these organized. Hey guys, give me a minute here and I'll be right with you. Okay, we're discussing mobile clinics and senior care for tonight for D. So here we go. Mobile clinics can be a game changer for senior care, especially in rural areas like Meadville, Pennsylvania, where access to transportation and specialized services may be limited. Here is a breakdown of how mobile clinics intersect with senior care, plus some local contexts and ideas for implementation or partnership. Okay, I'm going to go through these for you. Hopefully some of these help you. Those folks who need to know where they can plug in services and such. So here we go. Mobile clinics, what they offer seniors. Core services, preventative care, vaccinations, screenings, wellness checks, chronic disease management, diabetes, hypertension, COPD, things of that nature. Okay. Next, mental health support and cognitive assessments. Medication reviews and prescription refills. Telehealth facilitation and digital literacy support. Benefits for seniors. Reduces transportation barriers. Supports aging in place goals. Builds trust through consistent community-based care. Okay. Enables culturally responsive outreach and education. Okay, here you go for local people. Meadville, Pennsylvania, local senior care landscape. Okay, there are several senior care providers and in-home care agencies in Meadville, PA. Okay, care.com's directory list 24 senior care providers with experience in dementia care, meal prep, and companionship and hospice support. Okay, and then you have agingcare.com features 8 home care agencies offering personal care, respite services, and skilled nursing. Okay, then you've got Senior Care Finder. Includes listings for assisted living, memory care, and independent living options. While these services are facility or home based, integrating mobile clinics could complement them by reaching underserved seniors, especially those out outlying areas or with limited mobility. Okay, around here unfortunately we have people that can't get out of their apartments or homes or whatnot, so mobile clinics are great for those folks. Implementation ideas for mobile clinics, for mobile senior clinics. Code design with local stockholder. Partner with, here's your ideas, guys. Partner with Meadville senior centers, churches, and caregiver networks, including elders in planning to ensure cultural and logistical relevance. Modular service delivery, rotate services weekly, e.g. cognitive screenings 1 week, foot care the next. Use data to map high needed zones and schedule accordingly. Culturally responsive toolkits offer myth busting materials on aging, memory loss, and end of life care. Include life review prompts and integrational engagement activities, evaluation and adaptation. Track outcomes, e.g., reduced ER visits, improved medication adherence. Use mixed methods, feedback to refine services and outreach. Would you like to sketch out a pilot model for PA? We could co-create a framework that blends mobile outreach with caregiver support and culturally adapted interventions. Absolutely. Here are several standout examples of mobile clinics that have made measurable impacts in senior care and beyond, each offering insights you could adapt for culturally responsive community-based models. Okay, guys, I'm going to give you some examples of mobile clinics in different areas. The Family Van, Boston, Massachusetts. Attention, Harvard Medical School and Beth Israel Deaconess. Focus, material and senior health in underserved communities. Impact, launched in 1992 to reduce infant and maternal mortality among women of color. Offers blood pressure checks, diabetes screenings, and health education. Known for building trust and reducing ER visits through consistent presence. Adjustable feature. Community health workers on board to speak local languages and offer culturally tailored education. 2. Mobile clinic health map. Nationwide network. Scope. 3,000 mobile clinics across the U.S. Services, preventative care, chronic disease management, behavioral health. Impact, clinics have reduced preterm birth rates, and improved hypertension control. Uh, Proven ROI, every $1 invested yields $12 savings through avoided ER visits and improved outcomes. Adjustable feature combines medical care with social services like housing referrals and food access. 3. Geriatric mobile clinics, various U.S. locations. Focus elderly populations in remote and urban areas. Services. Cognitive assessments, medication reviews, fall risk evaluations, impact, tailored geriatric care delivered directly to seniors' homes or community centers, builds community of care, and reduces isolation through regular visits. Adjustable feature, group activities and peer support on board to foster social connection. Okay, mobile addiction clinics, California and beyond. Seniors with substance use disorders or chronic pain services, methadone, wound care, and naloxone distribution. Impact, extended access to harm reduction services for older adults, funded by opioid settlements, grants, and Medicaid waivers. Okay, adaptable feature, discreet, stigma-free access to care, familiar community settings. Would you like to co-design a mobile clinic model tailored to rural African American elders? We could build in life review prompts, caregiver support, and modular services like cognitive screening and grief counseling. We can extract some powerful, actionable lessons from these successful mobile clinic models, especially when thinking about culturally responsive senior care in places like Pennsylvania. Here's a synthesis of key takeaways. Trust is first in medicine. Lesson: consistently visibility and cultural humanity builds trust. Example: the family van succeeded by embedding itself in the community, hiring local staff, and showing up regularly. Application: recruit trusted community members, e.g., church leaders, retired nurses, and outreach liaisons. Offer predictable schedules and familiar faces. Okay. 2. Modularity maximizes impact. Lesson: rotating services based on community needs keeps clinics nimble and resilient. Relevant. Example: geriatric mobile clinics offer cognitive screenings one week, foot care the next. Application: use local data and elder feedback to design a rotating calendar. Perhaps integrating life review lesson or sessions, grief support, and chronic care check-ins. Education is core service. Lessons: myth busting and health literacy are just as vital as clinical care. Example: mobile health map clinics distribute culturally tailored materials on aging, memory loss, and chronic disease. Application: co-create toolkits with elders that address stigma, normalize cognitive changes, and promote autonomy. Evaluation drives sustainability. Lesson: mixed methods evaluation helps secure funding and refine services. Example: clinics that track ER avoidance, medication adherence, and client satisfaction show strong ROL. Application: build in simple matrix, e.g., pre-post surveys, caregiver feedback, and geospatial mapping of service gaps. Partnerships are power. Lessons: mobile clinics thrive when integrated with local systems, faith groups, senior centers, housing authorities. Okay, example: addiction focused mobile units partner with shelters and harm reduction organizations to reach older adults. Application: consider linking with local churches, rural health networks, and caregiver coalitions to co-host clinic days. Okay, guys, so that is D for you. Hope that gave somebody some insights. Hope that helps somebody with this situation, finding care and things. Because I hate to see some senior citizen fall through the cracks without finding care. So that is another reason why I did the show for tonight. So, with that being said, for now, Gator Wellness, take care, folks. See you tomorrow for shows.